how impacting do you think the value-based payment modifiers will be in terms of MIF payments year one in terms of their quality factors? Do you think the quality factors will change? And when is year one payments expected?
Okay, I'll try to take that one. So one, no one knows. I went to a conference last year. The Agency for Healthcare Research and Quality has a investigators conference. I received a grant from them to do research on the health IT and physician burnout and time efficiency and things like that. And I went to their national conference, and they had some folks, some health economists that were studying this. In other words, what is the level of evidence that if the government's quality, healthcare quality improvement organizations implement what they were proposing in MACRA, you know, what is the evidence? Has anyone done research to show that this will produce a benefit? And the answer is no. So in a sense, the level of evidence that's being used to create these programs is expert opinion. In other words, there's been no experimentation, no data collected that the incentives they're creating and the requirements that they're imposing on physicians and the healthcare system are going to do any good at all. So in a way, we're involved in a grand experiment here where, you know, and they've consulted a number of experts that study this, but if you actually look for hard data, and they had three, you know, one guy was from MIT and Harvard, and the other one was from Northwestern, and they basically just said, we can't really say anything because there really isn't any evidence for or against doing this. So that was your first question. And what was your second question again?
Well, in terms of the payment, using this data, there was a payment schedule, I thought beginning somewhere in 2019.
Yes, everything's 2 years in arrears.
Right.
So in other words, you'll submit your data this year, they take a data and analyze it and compare it to everyone else, and then you get your penalty or incentive 2 years later.
Okay.
And that actually causes trouble because a friend of mine is in a private anesthesia group, and I was at a party and I mentioned MIPS. I said, so if you have a person now that's a partner and then leaves, they may want a piece of that incentive that shows up 2 years later after they've left your group. I said, are you putting that in your contract? And he just looked at me and groaned. So, I mean, the 2-year arrears is a problem, I think, because for incentives to work, it should be very soon that you get the incentive. But a lot of people, you know, in 2 years, the turnover in primary care is huge, as an example.
Thank you.
Great. Thank you, Phil.